My name's Gershon Goodsey and this is MeloTV. Now there's been a spike in influenza and also pertussis in the country, all worldwide. But joining us in our MeloTV studio is Dr. Delano Rhode, a Paediatrician and Pulmonologist. Thanks for joining us right here on MeloTV.
It's always a pleasure being here, Gershon.
As I said, a spike in influenza, different strands of influenza, also it mutates, and I'm sure that parents are concerned.
Yeah, look, it's influenza. It's one of your flu viruses. It causes the flu symptoms. So usually kids come in with high fever, sore muscles. They are miserable. They have sore throat, joint pain. So it knocks you, and it's very contagious. So it usually lasts for about a week, but you need to know, if your normal antipyretics like your paracetamol or your ibuprofen doesn't work, you need to know when to seek your doctor. It spreads through the house. If one comes in, I would say, recognize the symptoms and make sure they hydrate themselves very well. Vitamin C is important. And then also to eat, make sure your diet is good. Good nutrition will make your body heal quicker. So it's important to sort of lift that side. And then if your kids do sport or if they're active, to maybe restrain them from that for a period of 10 to 14 days. Make sure they are fine afterwards, that they're breathing okay, that they don't have tight chests, that they don't complain of any chest pains, or that they're not short of breath when they do their daily activities. If any of those occur, rather go seek the help of your health professional and maybe just check that everything is in place.
Because obviously it can also have a strain on the little bodies.
Yeah, no, definitely. So some of the complications, for instance, of influenza is that you can develop a pneumonia. And if you do, it can be dangerous for you. So it's important, if you have any shortness of breath or any chest discomfort or even any chest pain, to have it checked out. Now, influenza is one of those viruses that you do get a vaccine for. So we usually advise all kids, with chronic respiratory conditions such as asthma or chronic lung disease, to go for the influenza vaccine. It's also sometimes we inquire if there's any elderly people at home with chronic lung disease or chronic cardiac or heart disease or any form of chronic disease, that you advise or seek advice from a health professional to find out, is it beneficial if they can get the influenza vaccine, and also the timing of the vaccine. If you have current flu, maybe find out, is it influenza? Is it any of the other viruses? You do get a whole string of other viruses that's also around during winter time, such as your rhinovirus, your adenovirus, your RSV virus, that makes kids also miserable, also affects their chests, also can give myalgia, which is sore muscles, sore joints. The typical symptoms, it sounds familiar, like 2 years ago when we were in the COVID pandemic. So any of your respiratory viruses give similar symptoms. It's just to be aware of it, and also to know which ones are preventable with a vaccine, and then also to note the complications if it occurs, and when it occurs, when to go to your health professional.
Our guest is Paediatrician and Pulmonologist Dr. Delano Rhode. We're talking now just about influenza, and obviously you could also get pneumonia. You can contract pneumonia or influenza or flu, kissing, touching, not sanitizing your hands, sharing utensils. We were talking also earlier about the 100-day cough. Yeah,
so with influenza, we're taking us back 2-3 years ago within the COVID pandemic. Everyone was, washing surfaces, washing hands, hand hygiene, so it is also spread by droplet spread. So if you cough, you can spread it, so then you can infect surfaces. So if someone comes and swipes his hand over it and it touches his face, he can contract it. If you within a certain span of someone that coughs, that's got influenza, you can contract it. So hand hygiene is important. Immediate symptoms, influenza makes you feel very, very uncomfortable. So especially your influenza B, for instance, you have severe muscle ache and muscle breakdown. So it's important to hydrate, to drink lots of water. Make sure you hydrate yourself properly, because that muscle breakdown can affect your kidneys and can lead to some kidney issues later on and currently. And then the 100-day cough. So we've seen a spike.
Sounds like a very long time to have a cough.
No, it is. So that's been caused by a bacteria called Bordetella pertussis. So it's your typical whooping cough. So again, you can have fever, a little bit of sore throat, and then develop this cough. And it's your typical, you cough and then whoop. So it's cough, 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 and then and so that's why it's called whooping cough. And it can be dangerous for especially babies, because you can develop apnea or cyanosis. So apnea is where you stop breathing, and then cyanosis is where you can turn blue. So that's usually when you suffocate. So that's the dangerous part of whooping cough. It is treatable. It is a bacteria, so you can use your macrolide antibiotics for it. But the cough can persist for some time. And remember, coughing can cause irritation on the air pipes, and it then can cause that the air pipes can go closed, so you can have a tight chest feeling. So it's important to observe if you have chest discomfort or your chest feels tight, to seek the help of a health professional. And also the treatment of it with your macrolide, depending which one you use, you have to make sure that you use the specific treatment duration, which can be anything from 7 days to 10 or 14 days of treatment.
All right. It is our guest right here on MeloTV, Dr. Delano Rhode. His contact details is on the screen. He's a pulmonologist and a pediatrician at Melomed Belleville, and a very good soccer player. Thank you so much for joining us on the show.
Thank you, Gershwin.
All right. From all of us at Melomed, please take care of yourself. Take care of your loved ones, and as Dr. Delano Rhode also said, if you need to seek medical advice, please do not hesitate. Seek medical advice before it's too late. From all of us at Melomed, thank you for watching this video, and until next time, take care of yourself. Goodbye.